Welcome to this week's episode of Surgeon Interrupted. I am so excited to have the ICU doctor in the studio with me today.
Thank you.
Welcome to the show.
Thank you so much for having me. Yeah, I'm excited to be here.
Oh my gosh. I can tell you, if you had been around when I was a resident, I say that like we weren't just like comrades, we just came up
Yeah.
together. But like if I had seen you and your content as a resident, I think that you are one of the only doctors in the world who would have made me feel really like seen
Whoa.
and safe in the hospital.
Oh my God. That means a lot. Thank you. Wow. I didn't realize I was that impactful.
You're like, I thought this was just going to be low key. I didn't know it meant all that to you. It does. It does.
No.
I think that you have resonated with a lot of physicians because
Mhm,
I think that there's a level of like realness and
mhm.
almost breaking the fourth wall
Yeah.
in medicine and hospital life that you've done so well.
Thank you. I appreciate you saying that. I feel like I've always just been like outspoken. And so like going into medicine, I think I just carried it on with me.
Which I love. I mean, there's a lot of people out there. I've seen transformations over the years. Like
Mhm,
sometimes what medical education, residency, fellowship attending, it can stamp out individuality. Like it can, if
mhm,
it wants to and if you let it. And so,
mhm,
um, I'm excited to get into it and really like, yeah, here's some of your wisdom because it is beautiful, to really like truly maintain one's own identity, but
mhm,
also even things like our own syntax, our own personality.
mhm,
Even when I used to wear, like, some of my own clothes into the hospital, and then I get a lot of commentary on
mhm.
my visage and my clothing.
Yeah.
Um, yeah,
Right.
it's a
Yeah.
lot.
Mhm. Yes, definitely.
I would ask if you could start off by sharing with us some of your background, just a quick overview of how you came into medicine and what your early years in medical education, medical school were like.
Yeah, so I actually was born and raised in Egypt. I came to the US when I was 10 years old, because my parents chose to, obviously. And when I came here, when you come from immigrant parents, I think there's a lot of pressure that you kind of have to perform because, they let you know. My parents were very vocal about the sacrifices that they've made to
Yes,
get
they
here.
let you know. We love
Yes,
them,
yes.
but they let you know.
They let you know, and so I never really, to be honest, I actually wasn't passionate about medicine, and I remember having this conversation with my dad about, like, "Do I actually wanna do medicine?" And he was like, "Well, what are you passionate about?" I was like, "I don't know." And he was like, "If you're not passionate about anything, then do something that's going to, like, serve humanity, like, you might as well do it if you're not passionate about anything else." So that's literally how I went into medicine. I actually didn't think I was very smart until I got to medical school because I actually had better grades in medical school than I did in undergrad. So I felt like I was surprised because I was like I thought I was just like below average, honestly, like most of my life, like, undergrad and things like high school, undergrad, things like that. So I think in medical school gained the confidence in like my educational abilities. And yeah, then I kinda, like, went on over. I grew up in Minnesota, I went to medical school in Kentucky, I did residency in DC, and then I came to Chicago for my fellowship. So I've kinda was, like, all over the place.
That's amazing, and I do think it brings up a really good point about, like, zone of genius,
Mhm.
and also just the fact that, like, we all really do have these strengths and weaknesses. I
Mhm.
remember back in my day when I took the MCAT, when I was still in college, um, my perfect score was in verbal,
Mm.
and I was like, "Hmm," my numbers were pretty unusual for an applicant, like, going
Yeah,
into medical school,
yeah,
um but yeah, that's really fascinating
yeah,
because, I know we wanna do a deep dive on this in a little bit, but
yeah.
this is such a great, like, foreshadowing because I think that a lot of the teaching that you do now, what I
Mhm,
would call maybe, like, digital medical education,
mhm.
distilling down for
Yeah,
digital natives and for the next generation, like, very complex critical care concepts
Yeah.
this clearly is a zone of genius for you. Like, you do that better than many people, and
I know, I'm kind of surprised, to be honest. I mean, the whole, like, teaching thing came on by accident, like, I actually, when I started my social media, I was like, "Okay, well, I'm gonna do teaching," and then I did teaching, no one watched it, and so then I was like, "You know what? I'm just gonna, like, be myself," like, humor and, like, all this
Mhm,
stuff, tell stories, and then that's really when I gained, like, traction, was more from my personality, and it wasn't until I posted a picture of, like, a worksheet that I made for my medical student on my story of, like, "Oh, I made this worksheet for my medical student," and then I got so many messages being like, "Oh, we want this worksheet, we want it." So I was like, "Okay," so I made a video, like, going through it, and then it kinda just took off from there. So, it was all kind of by accident, and then when people were, like, telling me that they finally understand, I was like, "Oh, wow. I didn't realize that, but I guess I guess I can break things down simply, but for me, you know what I mean? Like, my brain, like,
mhm.
that's how it worked, but I guess that computes with a lot of other people as well."
Yeah, exactly. I do think it resonates. There's also sometimes, like, a pretentiousness in medical education.
Well, I always say this, I was like, "Well, I'm not very smart, so I had to distill the concepts so that to a level where I can understand it." Like, that's because I'm like, "Okay, now I can make it finally make sense," and a lot of the subjects, it wasn't actually taught to me that way, but it was a way where it was like, someone told me something and I wrote it down because I always
Mhm.
kept all my notes on the computer, and then, like, I saw a lecture somewhere else or read something in the book, and then I would put it under the same concept, like the ventilator, for example. I just put, like, every time somebody taught me something, I'd write it there. And then I would sit down after maybe, like, months of, like, this information, and then I'd be like, "How can I put this all together so that it makes sense?" Because when somebody tells you one thing, you're like, "Oh, okay, that makes sense." And then you're like, "But wait, like, I don't remember what this other person said," or, like, and then you're just, like, confused all over again. Um, so I think that helped, like, me keeping track of, like, all the teachings that I had, whether it was, like, a podcast or, like, a conference that I went to, like, chess, like, I always take notes and, like, everything, and then I add it to that, like, subject.
That's awesome. Yeah, and that was
Yeah.
sorted out by topic like that, but as
Mhm.
broad as ventilator, but then you
Mhm.
organized within a subheading.
Yes. Yeah.
May I That's incredible. Was that on the notes app on your phone, or where did you literally keep that?
So, it depends. So, if I was, like, watching a video, like, an educational video, I would just take notes on my computer. If I went to a lecture, and if I wrote it down on a piece of paper, I would take a picture of it and then just, copy you can copy, like, the words and post it into it.
Mhm.
Or I sometimes would put it on my notes lecture. Like, when I went to conferences, I would just, like, type things as they go. Yeah.
That's amazing. I really love it. And by the way, again, it
Yeah.
takes genius to be able to distill these concepts. I love the old saying, and I think I'm going to paraphrase it a little wrong or be hyperbolic, which is that,
Yeah.
like, if you think you really understand a concept and you've
Mhm.
mastered it, but you
Right.
can't explain it to like a 5-year-old, you haven't mastered the concept.
Yeah. That's true. I've heard that before. And I've had like patients comment on some of my or like, people who have like family or stuff, like not
Wow.
my personal patients,
Yeah.
comment and say like, "Oh, my dad is in the ICU and like I finally understood like what this meant, like what was happening because I like watched your video." And I was like, "Oh wow, like, like you don't have to be in medicine to understand or like conceptualize the things that I'm saying."
Yes. I love that. This kind of goes back to, and it is something that I've always side-eyed, which
Mhm.
is like the old traditional pretentiousness of like
Mhm.
doctors in medicine. They are all up here. Students and definitely the general public, patients and their families, like, oh, they can't understand. It's behind like a veil and they're down here. Like, I do
Yeah.
think that that relationship, that hierarchy, it was, like, manufactured. It's not
Mhm.
necessary. It's not
Yeah.
real. So the more that we can act like, "Oh, no, we're together. This is a horizontal relationship,"
Mhm. Exactly.
the more beautiful, um, of, like, connection and certainly the healthier workforce, etcetera, that we can have.
Yeah. I remember a lot of times as a resident or even as a medical student with like the attendings would explain things to patients. And I would be like, "I don't think they understand, like, what is going on." Did you have that too? I'd be like,
Yes.
"I don't think they, like." Yeah, and then I'm like, "These people are gonna go, like, home and be like, I have no idea what just happened."
Totally. I know, but that is like, yes, you articulated it so well because I have 100% seen that. But that's like what is so
Yeah.
weird and unnecessarily creepy about like the medical trainees. We have to act like, this really big attending, like, no, of course, like you're killing it. Two thumbs up, man. And like you just see
Yeah.
plainly this is not working. You're not
Right.
communicating your diagnosis or next recommendations like very clearly.
No. No.
That's hilarious. Okay, well, this is a perfect segue because one of my favorite things about you is, you have a lot of great series on unhinged things that you did
Yeah.
along the way.
Yeah.
And of course, I don't think they're unhinged. I'm like, this all seems really reasonable to me. But
Mhm.
I would love to hear about the most unhinged thing you did as a resident.
Most unhinged thing I did as a resident? Hmm. I will say I wheeled a patient down to the IR suite myself and asked the attending to intervene because I was like, I'm convinced it was this young female who had a kidney biopsy and she was like in excruciating pain after I was the resident, I had my intern and she was like complaining of pain. And we were like, "Okay, like, give her some Tylenol. It's a kidney biopsy, it shouldn't hurt too much." But then they called again, they were like, "She's still in pain." And I was like, "No, this doesn't make sense." So then I went to see her and she's, like, writhing in pain. So, we order, like, a stat CT because I was like, "She's probably bleeding." Because I tried to move her legs and she screamed and I was like, "Oh,
Oh,
there
no.
this is, like," because she was, like, completely normal before. And so, we were, like, waiting for, transport to come, and they didn't come, so I told the nurse, I was like, "You know what? Let's get 2 milligrams of morphine, and let's wheel her down ourselves." So I wheeled her down to the CT scanner, went to the, interventional radiologist who had done her biopsy earlier,
Mhm.
and I was like, "I think she's bleeding." And he's like, "No, I did, like, CT guided biopsy, whatever." So then I was like, "No, I think she's bleeding." And he's like, "Okay, fine." So we put her in. She is bleeding. She had, like, a huge hematoma,
No,
RP
that's so
bleed.
scary.
And then he's like, "Oh, okay, yeah, she is bleeding." So I was like, "Okay." I wheel her down to the IR suite. She's on a monitor, everything, like, she's not but and then the IR attendant, I remember him, he's like, "Who are you?" And I was like he's like, "Are you the medicine attending?" And I was like, "No, I'm the resident." And he's like, "Oh." But I remember being like, in my head in that moment, I didn't feel like I was doing anything weird. Like, I didn't ask my attending, like, I didn't really, like I was just like, "This is what's happening, and I'm gonna do it." And I told her about it afterwards, and she was like, "Fine," but yeah. And the patient did okay, but she did have a bleed, and they stopped it.
And you were right. I don't know.
Yeah.
I wouldn't even call that an unhinged thing. I'd be like, you had good clinical acumen. And you were right. And it's time sensitive.
Yeah, exactly. Um, yeah, I think, to be honest and, I mean, to be honest, I think most attendings or people let me get away with things because my hunch I feel like I have this, like, hunch when I look, like and I think that's part of why I chose ICU and m probably why I think I'm a good ICU doctor is, like, I can tell when somebody is, like, it's not right,
Mhm.
like, and
Mhm.
it's not the ones that, like, are on 3 pressors, like, obviously this person is sick, but it's, like, the ones in between that you're like, "No, this person is actually sick." Like, um and so I think I had that in residency too, and because, 9 times out
Mhm.
of 10 I was right, they were like, "Okay."
Yes, yes, that's a very good point. I liked to call it a spidey sense. I feel like my spidey sense, same thing. It was quite good. Like I
Yeah,
feel like if you showed 5 people, like in my cohort,
yeah,
5 people at my level, a neck that's
yeah,
after a big flap recon, and it's like the earliest signs of fistulizing, I
yeah,
feel like I would see it.
yeah,
And I
yeah,
would appreciate it before others would appreciate it.
yes.
And that's the spidey sense, and it's interesting because I was a fairly hellacious resident, so I
Yeah.
probably made you look like an angel, but I was able to get away with more
Yeah.
because of a highly attuned,
Mhm.
high fidelity spidey sense and clinical acumen.
Right. Exactly. Yeah, I think because I was usually right, I think the attendings kinda, like, let me get away with a little bit more, or if I, like, gave him a little sass or something, I didn't necessarily get in trouble. But
Yeah,
yeah,
you can't be sassy and
bad.
wrong.
Yeah.
Like, yeah, like,
Yeah.
just bad at your job, making the wrong calls, like,
Yeah,
messing up. You can't be that's a good lesson. That's, like, a good takeaway. Like, you do have to pick one.
yes.
And so if you're making a lot of, like, clerical errors, that's
Yeah.
not even the end of the world, but you can't also be sassy.
Right, exactly.
Get
Yeah.
your orders cleaned up, and then and then you can. I guess my question would be, how often did you catch your attendings by surprise, though? Because I have a hard time picturing it. Like, I think that if one person had even shown
Yeah.
a modicum of sass, that it
Yeah.
would have probably shocked and awed everybody on the team for teams I was on. Like, we didn't have that many jokes. Not that many jokes occurred. And certainly, depending on who the attending is, if you
Yeah.
said a joke, like, you may actually, I don't know what they would have done to them, kicked them out or something.
Yeah, I remember actually one of my attendings in fellowship, he was, like, very, very serious, like, very serious, and, like, the kind that never smiles, like, he was very, very smart, so, I learned, like, my first, year as a fellow, I was, his fellow, and I said something, and he shut me down so quickly, and I learned I was like, "I cannot talk on rounds." Like, that was, like, my first takeaway because of how he's like, "No, that's wrong because X, Y, and Z," and all this stuff, and, like, I was like, "Okay, I'm just not gonna say anything, from now on." And then when we would sit down, I remember then, like, later we were on nights together, and I started asking him questions. Like, I was just like, "So, who's your best friend?" He's like he's like, "What?" And I was like, "I'm
No.
just like" yeah, I was like, "I'm just interested to know who's your best friend." And he's like and then I kept asking him questions, and in the middle of it, he was like, "Why are you like this?" And I was like, "I'm just trying to get to know you." And then I found out, like, about his wife. I asked him where they got married. I asked them, like, how many kids they had. I asked them, like, what they were for Halloween. I asked to see pictures. I was, like, all up in his business. And I kid you not, like, this man went from this being, like, this scary, like, person to when he wasn't even my attending, because there was always, like, 2 attendings on, because there was 2 ICU
Mhm.
teams, he would come and sit in our pod next to me, and he started, like, telling me all these things, like, that he watches, like, Dave Chappelle and, like, all these like, you would never guess that this person was, like and, yeah, he even invited me to his house and, like and I was like, "I broke him." I was like, "I got through, I chipped away." But by the end of it, yeah, he was like he liked me, and I was like, "Okay, you do have a personality," or just, like I don't know why he acted like that. I think he just didn't want people to talk to him, like, he didn't wanna be, like, approachable, maybe?
Yeah, I just didn't wanna be bothered.
Yeah, but
That's so sweet. First of all, I feel like I would watch the A24 movie of, like, that story, like, you
yeah.
and this old man. I'm actually pretty interested.
Yeah.
Oh, man. Okay, but here's kinda my question, right? Because like, I love that story. I think that that's incredible. It definitely makes me be like, "Okay, well," again, um, I do think back on my residency, and I don't enough time has passed. I don't beat myself up about this, but I do think if a time machine or Freaky Friday situation, whatever
Mhm.
happened, I would play it differently because, like, when unattending would be really scary and unapproachable and deliberately really intimidating.
Mhm.
Deliberately, for sure.
Yes,
Like,
yes.
so intimidating, shutting everyone down.
Mhm.
Um, it never occurred to me to ask, who his best friend was
Yeah.
or get to know him. Like, I just
Yeah.
feel like it made me be like, "You must not have any friends,
Right, right.
and I hate you." Like, I don't I
Yeah.
wasn't able to spin zone it, but here's my question for you. What would you say to anyone who is in that position now and they, like, are also inspired by what you're describing? They want to do what you did, but I guess my concern, because again, our personalities are very different. Like, even if I, like, try to give a big smile and I'm like, "Who's your best friend?" They might be
Yeah,
like, "You're freaking me out. Why
yeah,
are you so close?" It's like, how can people, when they don't have your personality, natural people skills, seemingly a lot of questions about personal life on deck. I've
Yeah.
never asked anybody all those questions. I don't think I know those things about my best friends. So it's like, yeah, what advice would you
I
give
think
them?
I think that it's, like, testing the waters. You know what I mean? It's just like it depends on the person, and I think it depends on you. You don't have to be like, "Who's your best friend?" I mean, you can start with something like a little bit more like, any play like, "What did you do last weekend?" You know what I mean? Like, "Are you taking any vacation soon?" Like, something that's a little bit less because even if you do that, then it's, like, based on their response, you can kind of, like, ask more questions like, "Oh, you're going to Italy. Oh, I've been to Italy. I've been here and that. Do you guys have an itinerary already? I can send you some things I've been" like, whatever, like, making, like, that small conversation, but yeah, I think that would probably be, like, a safer thing, but I think it would be fine to ask those things. I don't think there's anything wrong with us getting to know, like, our attendings. I think it makes work more fun in a sense, so
It definitely would. But yeah, it's a two-way street, but I almost feel like, with your line of questioning, it's like you jump and then the net appears. Like he did then engage in the two-way street. Um,
yeah.
that's very interesting. Okay. Well,
Because I
um,
was like, also, when you think about it, these people, I'm like, what is he actually gonna do? He's already intimidating me. He's already like scary. He already tells you like you're stupid or whatever, makes you feel stupid. So it's like, okay, what is gonna happen when I ask him that and he doesn't tell me? What is he gonna make me feel like more stupid? It's like, what is gonna nothing. Is he gonna go report me because I asked him like what his kids were for Halloween? Like you know what I mean? It's just like, what is actually going to happen? Like, nothing. And it's like, if this person is already all of those things that I've named, it's like,
yes, that's brilliant. No, you really are a genius because, like, you're so right. And but I lived in
yeah.
a prison
Mhm.
of I'm afraid of getting called to the principal's office. I'm a grown ass woman who's like
Right.
so afraid of, well, we don't have a principal's office in residency, but yeah, it is hilarious because it does almost put the onus on them too. It's an interesting bluff play, which is like,
Mhm.
I do dare you to
Yeah.
tell the chair that I asked you who your best friend was. And then
Yeah.
that triggered you because you do not have any friends? Like what?
Yeah.
It's very interesting.
Yeah.
But this kind of goes into, again, I think that there's a lack of pretentiousness here or a willing to humanize everyone and say, like, well, attendings are human and fellows are
Mhm.
human and residents are human.
Right.
Do you feel like now that you're an attending and you do control, the vibe and you lead teams and things like that, does it feel different?
I think it feels way like different. Like I think I don't know. I practice in a community-based setting. I do have medical students,
Hmm.
but I don't have like residents or like, interns or fellows or anything like that. So it's a little bit different, but I think the vibes as far as the vibes go when I'm on is like it's fun. Like we literally sit like me and the nurses or like the RT's pharmacy, we sit and we just like shoot the shit. We talk about things. I'm like last week I was like, let's look at houses none of us can afford. You know what I mean? Like, let's go to Zillow and look at like $1 million houses and like how nice we are and like talk shit about them. Like, that's literally what we were doing. Or we'll be like, oh, let's plan this or whatever. So I think it like makes it more fun and like it makes work go by like faster. And I've never seen now, given it was, like, in a community or, like, academic setting and, like,
Hmm.
the attendings never stayed, right? But I also
Right,
never
right.
really saw, like, the residents and the nurses or, like, pharmacy they never really besides rounds, it's like there was, like, no sense of community or, like, sense of, like, team, but beyond just, like, rounding on the patient. And I think, like, given my position now that I'm able to do that, not only does it make my job easier because the nurses are willing to do extra things for me when I don't have to ask, and I do it for them too.
Hmm.
Um, and now when I ask them to do something, there's no, like, amino
Animosity.
animosity between us. It's like they understand, they know who I am, like, as a person and not just as, like, a physician. Um, and yeah, I think it's, like, a great environment to work in because of that.
That's awesome. I honestly, I know exactly what you're talking about. Like
Yeah.
I'm thinking of like I have some fond memories. I remember, certain ED shifts over the years, a couple,
Mhm.
yeah, ICU nights like where it hits right. You have like a nice group of people
Mhm.
who are man, it's like I almost one of the best terms that has helped me conceptualize this is like put others at ease.
Mhm.
Putting others at ease. Again, I can say this as a surgeon, right? Like surgeons, I
Mhm.
think famously will not do it. They do not want to do it. We are not taught, hey,
Mhm.
there's a value, there's an importance to walking into a room,
Yeah.
whether it's patients and family in the room or whether you're walking into a room with your team. Maybe it's
Mhm.
nurses and techs and some learners. It's beautiful and
Mhm.
wonderful to put other people at ease.
Yeah.
And I say that again as a reformed person because until 5 years ago,
Mhm.
I didn't think that.
Yeah.
That's why that's why I think I really do try to say, um, until 5 years ago, I thought
Mhm.
that the game that I thought we were all playing, like what was modeled for me since about age 20 was we walk into a room and we intimidate other people and we try to
Yeah.
prove that we're smarter and have
Mhm.
power over them. Like, okay, hindsight's 2020 because I look back and I'm like, wow, I could not want to play that game any less, and I feel sad for the younger
Mhm.
version of me who got sucked into it and was, like,
Right.
very impressionable.
Right. Yeah.
What I think is amazing, though, like, even the type of work environment that you're describing,
Yeah.
a lot of us can probably picture I can picture a couple phenomenal docs, like, over
Yeah.
the years, especially in those early years,
Yeah.
like what you're describing as your attending life,
Yeah.
and that person does put the team at ease. It's literally magical, like, great
Yeah.
patient care happens, people have fun at work, and
Mhm.
then you think, or I think, I want this job. This is awesome.
Yeah.
Like, work is probably
Right.
still always work, but I love this
Yeah.
job.
Yeah, exactly.
So what would you say to people?
Yeah.
Because it's a long journey, right? Like, it's
Mhm.
over 10 years, to get to that point, it's a long ride, and I feel like all the things that I really didn't like about medicine and surgery, it
Yeah.
wasn't all of what we're talking about right now. It was
Mhm.
just that there's a lot out of our control. We're often on a team where we
Yep.
don't control it, and that's not the vibe. What would you say to almost like reassure, comfort, or inspire people who are stuck in that situation?
Stuck in the situation of, like, just a bad environment at work.
Yeah, like a
Mhm.
suboptimal work environment. And I mean, yes, it might be temporary because let's use people who aren't attendings yet, because then they could be setting
Yeah.
their own vibe.
Yeah, yeah. Right. I think for me, what helped when I was in those situations, like the first year fellowship was very hard for me, is like having something to look forward to. So whether that's graduation, if you're almost to graduation, or it could be something like a trip that you're about to take, or your best friend is going to come visit you. Like I always had something that I looked forward to. And so when things were really rough at work, I always like reminded myself, it's like, okay, it's just 8 more days and then I get to do X or I get to see blah or whatever. So I think like having that, like think of it in as like chunks instead of like, I have 3 years left till I'm out of here. It's like it's not as digestible when you think of it that way. And I think that it's temporary, right? Like a lot of it is just like this is temporary. And lastly is like your mindset of how you view things because perception plays a huge role in like how we view reality. Like part of reality is your perception of it. And there are at all times like different realities based on how you perceive things, you know? And so if you're like, for example, if somebody asked me to do something like put a chest tube in and it's like 30 minutes before I'm gonna leave or something, I can be upset that I'm gonna be doing the work and I still have to do it and I'll just be upset. Or I can say, oh my God, I only done like 9 chest tubes. This will be like cool because I'm about to be an attending in 6 months and I should probably learn how to do this. So it's probably worth this day. Like, reframing things like that, and obviously, it's not gonna always work out like that, and it's okay to have bad days and be, like, upset at things, that's normal too, and it's okay to allow yourself to have that too.
That's awesome. Okay. that's very wise. Certainly, like, even in therapy and adaptations of, like,
Mhm.
DBT skills that I've worked on with clinical psych PhDs, like, with
Yeah, yeah.
professionals for this, um, we do that exact type of reframing work, which is, like, instead of, "I should stay late to help out with this late admission,"
Yeah.
we we evaluate the shoulds in our language because
Mm.
a lot of strife comes from that. I should,
Mhm.
or I shouldn't be doing this and I'm doing this, or I should do this, but I don't feel like doing that. She should be doing X and she's not doing it. Like it
Yeah.
so much strife comes from the shoulds. But
Right.
like, I feel like now at 34, I
Mhm.
have some of these skills.
Yeah.
It is not natural. I had to learn them the old-fashioned way, like,
Yes.
late in life through therapy and stuff like that, but I
Mhm.
I would just love to know, like, where do you get them from? Because
Yeah.
that sounded very natural, and it sounds, much more deeply ingrained in your actual
Mhm.
tools and, like, accessible mindset than for me. Because I can do it. I can get to the right, correct, same answer as you.
Yeah.
It is not as natural.
Yeah, and I'm gonna say, like, it's not like I'm, like, always happy, whatever, accept any shit that comes my way. Like, I'll be the first to complain, don't get me wrong. I think complaining is therapeutic too in a way, but, like, for me, part of it was therapy, and then I had, like, in residency, like, halfway through, I did a lot of, like, self-work because I was very depressed and, like, not in a good mental state, and I think through therapy and then reading a lot of self-help books, um, I got there and I started believing in, like, the whole, like, vibrational energy and, like, being positive, like, that's the energy that you're going to draw to you, and I manifested and, that comes with, like, the manifestation. I feel like I manifested, like, the majority of the things that happened in my life afterwards,
Mhm.
Like, I was like, "I'm gonna buy a condo in downtown Chicago as a resident, and I don't even live there yet, but I'm gonna do it." And I did. I made it happen because my brain already believed that it could happen, and that happened because of all the therapy and the books that I've read, and I will say the one book that kinda really got me started
Mhm.
is, like, You Are a Badass. I forget the author right now, but that book literally changed my entire life.
I
Um,
love it.
yes, so that's kind of, like, how it began, and then it's just been, like, years of that since.
Jen Sincero. I was picturing the cover. It's this bright
Yeah,
yellow
the
cover,
yellow
and
yes, exactly, yep. Yeah.
it is obvious that you are mentally very strong, and I love manifesting. I agree with you. Well, I have seriously had the best time chatting with you. I want to make sure before we close up here, could you tell us a little bit about like your ICU pocket notes, where people can find them?
Yeah. So the ICU Pocket Notes is essentially a all of my ICU notes that I've compiled throughout the years. Like I was mentioning earlier, all my notes, I would like rearrange it to make it make sense. I'm very big into like one page things because I don't have the attention span to read like a million things. So most of
Hmm.
the concepts on there are in one page. Um, like diagnosis, treatment, etc. And you
Hmm.
can find it on Gumroad. Yeah.
Awesome. Okay, we
Mhm.
can link it in the show notes down here.
Okay.
Very excited to get to chat with you about all of this tonight. Thank you so much for being here.
Thank you for having me. I had a great time.
Awesome. Well, hopefully, many people can take some inspiration from you. I'm literally like, you have me almost just emailing my old attendings. Hey, who's your best friend? Sorry, I
Yes.
never asked you more about yourself. That's probably it could have made things better
Yes,
for
it
sure.
could've. Yes, it's like, I realize now what had happened. Yeah, I should have asked you who your best friend was. Yeah.
Should have showed more interest in your hobbies.
Okay.
Thank you for listening to this week's episode of Surgeon Interrupted. If you enjoyed this episode, please subscribe, rate, and leave us a review. Check out all of our shows and content at hippocratic-collective.com.